Hi, I'm Mike Kozlowski, and I'm an optometrist, and I'll be participating in the upcoming mission trip in Hermosillo. In this video, I'm going to be talking about measuring visual acuities, or VA, and this is station number 3. Visual acuity is defined as clearness of vision when trying to distinguish objects. So some examples of reduced visual acuity would be not being able to read street signs when you're driving, or tell what's on your cell phone, or not being able to read books or do close-up tasks like sewing or repairing things. Most people who come to our mission will have a complaint of blurry vision, either at distance or at near or at both, so they can't recognize or distinguish objects at those distances. In order to help these patients, it's necessary to have an accurate measurement of how good or how poor their vision is. If we don't have this information, then it's very difficult to know what kind of glasses, if any, they need, or maybe if they need some other type of treatment. So for example, if a patient has diabetes, then the diabetes can produce blurry vision, and sometimes that vision can be improved by glasses, but sometimes it requires some medical treatment, and your proper measuring of acuities will tell us which of those options is most likely. So if you're volunteering at the visual acuity station, your work may seem repetitive. You may not understand all the steps you're doing, but it's very important that you properly measure their acuities so that we will know how best to treat the patient. I'm going to demonstrate how we measure VAs, and I want you to do it in exactly this way. If you have any questions or problems while you're measuring VA on a patient, just stop, have the patient wait, and go find a doctor to help you. There should be optometrists near you, maybe at your station. Certainly there should always be one at station 5, which is triage. I'm going to break this down into 3 steps. The first step you will do on all patients, and that's measuring distance acuity. And we'll use one of these types of charts. So this is called a Snellen chart, and you can see it's composed of lines of letters, and the letters get smaller and smaller as you go down the chart, and you have the patient read the letters. Another is a tumbling E chart for patients who maybe don't read letters, and this one has symbols on it, and you have the patient indicate what symbol they can see. So if they can see this symbol clearly, then they will do this. If they can see this symbol, then they can do this, etc., until they can no longer distinguish the symbols. And if that doesn't work, if they don't understand how to do that, we can use a straight symbol chart like this, in which they can say house, maybe star, square. Excuse me. The patients will stand at 10 feet or about 3 meters away. They can wear glasses if they have prescription glasses for distance. Okay, if they have any other types of glasses, so glasses someone gave them, glasses they found in some store, readers, glasses that that their friend gave them, no, only prescription glasses prescribed for them. Don't allow the patient to squint because that will change the measurement, and we're going to measure one eye at a time, right eye and then left eye generally. So to do that, you'll do the following. You'll have them cover. Let's say their left eye, they're going to read with their right eye. Make sure it's completely covered. Don't let them peek around it, the occluder. They can also use their hand if you don't have the occluder handy. Then you will ask the patient to read the lowest line on the chart that they can read. Don't let them start at the top. Have them go to the lowest line they can read. So let's say they say they can read this line. Ask them to read it. Let's say they read it as E-T-C-D-O-F-O. So they got 2 incorrect, but they got more than half of the line correct. So now ask them to read the next line. If they also get more than half of that correct, ask them to read the next line, etc. If they get less than half of it correct, then you will go back to this line as the last line that they were able to read more than half of correct. Now, sometimes a patient won't want to go to the next line because it's a little blurry, it's hard for them to read, or they're afraid if they read too well, they won't get glasses. But it's important to push them. So they get more than half of the letters, push them to read the next line. And it's fine to say, just guess at the letters. Okay. Once you have the lowest line that they could read at least half of the letters correctly, you will look for the numbers at the end of that line. And what you're looking for is a number with that has 20 on the top and 40 on the bottom. So this would be 20, 40, if that were the last line they read at least half of the letters correctly. Then you will record that on their chart, which they should have with them. It'll be here in pre-testing. It'll be over here entering acuities, and you can see for distance, there's a right eye place here, 20 over whatever it was for the right eye, and 20 over whatever it was for the left eye. And then if they were wearing glasses, you will circle aided right there. And of course, you're going to do this for both eyes individually. Now, if they read 20, 30, or smaller, so let's say I had our patient stop here because they couldn't read all the letters on, or the majority of the letters on this slide. But let's say they could read half of the letters on the 20, 30 line or better. Then they'll go on to step 2. So if they're reading down here, go on to step 2. If they're not, they won't. They'll go directly to step 3. So in step 2, we'll check their near vision. And we'll do that exactly as we did for distance vision, only using a different type of chart called a near card and a measuring distance of 40 centimeters or 16 inches rather than the distance of 10 feet or 3 meters that we use for distance. So this is one type of card, and they can read. You can use this card if they can read numbers. You can use it as a tumbling E card or just figures at O and X and O. And you're going to do it the same way. So what smallest line they can read, if they get more than half of that correct, push them down to lower lines. And then when you get to the smallest line that they could read more than half of correctly, go to the end of the line, and you'll record those numbers right there on their chart. And this time you'll record it next to distance, VAs under near, right here and here. And then they can go on to the next station, number 4, which would be autorefraction. Excuse me. For those patients who could not read the 20-30 line, so they couldn't read the 20-30 line, maybe the best they could, maybe the best they could read was 20-40 up here or above, then for them you will do a pinhole test on. For the pinhole test, you will use this device. So you can use this side to occlude an eye and this side to have them measure their visual acuity. Again, you'll do it on both eyes by simply turning it around. Let's start with the right eye. They'll take their glasses off. They will look through the pinholes. Let me just show you what these holes actually, they are actual little holes, as you can see. And they will look at the chart. You'll ask them again for the lowest line they can read. If they read half of that or more correctly, then move to the next lowest line. I should say if the first line that they say they can read, the lowest line they say they can read, they don't get, on any of these tests, they don't get more than half of it correct, then have them move up to the next bigger line until they do get more than half of the letters correct. At any rate, once you have found the smallest letter, the smallest line that they can read at least half of the letters correctly with the pinhole, then you will record that on their chart. And that will go in the same general section. So we've got our pre-testing, we've got our visual acuities right here, and right below it you'll see this gray area. So right in there, PH for pinhole, and then OD for right eye, and whatever it was, 20, 50 let's say, and then OS for left eye, and whatever you got for testing that eye. And then these patients can also go to station number 4 for autorefraction. Thank you all for participating in the trip and for the important work you'll be doing if you're working at station number 3.